Hi, I'm Dr. Mukesh Gupta from Lenest, Malad, Mumbai. Perineal care, meaning how to take care of your private parts after normal delivery. Well, once you've delivered normally, many times you land up, rather most of the times you may land up with a stitch called as episiotomy. It is a deliberate cut given in the perineum which helps in giving a little extra space for the baby to come out. And normally it is sutured by sutures which are absorbable and then they fall off on their own after some time, and you don't need to get them removed as such. But how do you take care of your perineum at home or in the first few days after delivery is what we're going to discuss in this video. Well, first of all, the first tip is that remember that it is in a location which is destined to get dirty and easily infected, because this area is in between your vaginal opening from where the baby has come out and your anal opening from where your motions or the stools come out. So this small tiny area is destined to get infected if you don't take care. Well, that is the reason keeping it clean all the time is very important. That's the golden tip. So every time you go for your motions or every time you go for your bath or you go for your urination, please wash that perineal part clean with water and soap. If possible, you can use some antiseptic soap or something like that which can help you to keep it clean. Or better still, there are perineal washes which are available, which have got peculiar pH which helps in restoring the normal flora. So that's the first tip, keep it clean. Second, whenever you're washing them, remember the second tip, that you are going to wash it from forward to behind and not from behind to forward. When you do it from behind to forward, you're bringing in the microorganisms from the anal canal or the rectum and the place from where the motions are passed right ahead, and this increases your risk of infection. So keep it that way. Don't wipe from behind forwards, but clean it from forwards behind. Third thing is keep it dry as much as possible. It is impossible to keep it dry all the time because you're going to have a discharge which is called as lochia after delivery. So initially there is blood tinged discharge and then it becomes pinkish and whitish and it goes away. It may go on for almost 4 to 6 weeks. So how do you keep it dry? So whenever you go to the toilet, wipe it with tissue paper, keep it dry as much as possible. Use sanitary napkins. Do not use tampons. Tampons are not a good idea because tampons may get accumulating blood soaked up in them and you will not realize that they are really getting soaked up and big, and sometimes because of the lax vagina, it is forgotten tampons or displaced tampons are a big mess and can lead to a disease called toxic shock syndrome. We don't want that. So that's the third tip. The fourth important tip is that when you're washing or cleaning them, you can use warm water or a seeds bath, what you call it. So initial few days, you can sit in a tub with a providone iodine or similar such solution or antiseptic solution as advised by your doctor, and that will help you to make you feel better. Not only the warmth of the water makes you feel better, increasing the circulation there, but also it helps you to make you feel good about it. So you can use that. At the other end, if the pain is extreme and excessive, to subside the pain at that local area, you may use cold compresses. So you can purchase those cold compresses and keep them in your freezer, and whenever you need it, you can keep changing them. And that's another tip, using of appropriate temperature to help you feel soothing. So that's the fourth important tip. Now, fifth important tip, when we are taking care of the perineum, every time when you are washing it or when you are going to toilet, at least 2 or 3 times apply an antiseptic ointment there, which will help to prevent the infection to some extent. And that's a very important thing that you need to take care. Next tip about the perineum is that when you're sitting and feeding the baby, which is inevitable, you'll be sitting all the time and feeding the baby all the time. Patients come and say, "Doctor, I feel like a cow all the time. The baby is demanding milk." Well, you're supposed to give the food to the baby, and that's the only way the baby is going to get the food. But then you need to be sitting all the time to feed the baby. Many times it is not easy for you to lie down and feed. Use a pillow. Use soft support in the base. Position yourself, and sometimes if the stitches are more painful, you can apply a pillow on that side to elevate that area so that it doesn't come under pressure, and really works wonders. So pillow is something which really helps you to get feel much better. Next important tip is that when do you know that things are not improving and when do you need to go to see the doctor? Always visit your doctor when you feel redness, extreme soreness, pain, swelling, foul smelling discharge, or any boils or rashes coming nearby. You should immediately report to the doctor, because if that is not taken care of at the right time, it may just keep on increasing, and that may cause a lot of problem, and that is something which we don't want us to suffer from. Next important tip is that how often and how long should we take the medications and other things. Well, for the first few days your doctor may choose to give you an antibiotic depending on the situation and depending on what is the protocol of the hospital. Don't be scared about taking it. It is good for you and it will prevent the infection. But more important than anything, the doctor may give you some painkillers and analgesics and some anti-inflammatories to reduce the swelling and the pain. And in that case, please do not deny it and take it, and it will help you to ease the pain and heal faster. Sometimes the swelling which is accumulating there can cause a little bit of extra pain, and that can be subsided by using the appropriate medications. Last but not the least, if you have a doubt and if the swelling is sudden and rapid increase, there might be some blood vessel or some hematoma which may be developing, and that may be a little problematic thing. Report to your doctor immediately without any delay, and that is something very, very important, because an infection or a hematoma are two big problems for the wound to give way. Lastly, even if there's something wrong happening there, remember everything can be managed. Even if there is a little infection or swelling, or the stitches are not healing well, or if they have not stuck well, they will heal well, because our body has tremendous healing capacity, and it is very rare that the stitches have to be taken again. Most of the times they heal very well. So if you have any doubt, please go to the doctor and they will advise you for appropriate care for your perineum depending on your situation. Thank you very much.